So thank you very much for joining today's discussion as part of Agenda Dad. And just to start again from the beginning, Agenda Dad is all about looking to level up the policy and practice field in the UK for fathers. And this event today is part of a wider series of events that are being held or being promoted through the International Men's Day website. The theme for this year, just to raise everybody's awareness of the theme for IMD, is zero suicide. Now, today's talk is not addressing suicide, but we are really, really fortunate to have Dr. Mark Cobain here with us today to talk about the physical health outcomes of fathers. And before we started, it's my feeling, and I'd be very interested to hear people's thoughts in the chat, that often we talk about the fatherhood as a teachable moment, but we don't. And there is quite a lot of discussion, I would say, from my perspective, around the mental health of fathers, but we really don't talk that much about the physical health of fathers, and that's why I was so keen to invite Mark, who I've known for many years, to come in and share his research and knowledge about this particular topic. So I'd like to invite Mark to introduce himself. But Mark, before you do, did you park run this Saturday?
Did I park run this Saturday? I didn't park run this Saturday. Did I? No, I didn't. Much to my shame. But I did the Nedworth 10K. So that's my excuse.
Well, that's very impressive. Very impressive. Yeah, very impressive. So, Mark, could you introduce yourself and tell us about the work that you're engaged in before going into the meat and potatoes of the talk today?
Yeah. So should I share screen and then do it over the top of that?
Sure.
Is that okay? Then it saves me trying to do two things at once, which I'm not particularly very good at. Here we go. Hopefully, let me see slideshow. There we go. Okay. Great. So so thanks, Chris, and thanks, Future Men. It's a real pleasure. It's been fascinating actually just preparing for this, thinking about this topic in preparation for today. So just to introduce myself, I get this sort of important stuff done first. So I'm a father. I'm a father to two teenage boys. And I'm a stepfather to two other teenage boys, and I'm a son to a father who's sort of struggling with his own health in sort of later life. And I'll come back to that in a moment when we think about what healthier, happier dads means over the life course. In terms of my background, I guess from a kind of academic point of view, my training is I'm a psychologist. That is my research background, and applied that a lot to large epidemiological studies. So I have a epidemiological understanding as well in sort of large studies like the Framingham Heart Study and many others around the world. I spent most of my working life across not just the private sector, but also the charity sector and academia in very different worlds, but mostly focused on age-related conditions, health, like cardiovascular disease, diabetes, and memory loss related to aging. And also sort of generally healthy aging. What does healthy aging mean? What do we mean when we say healthy aging? Both as people who will age and also academically. And then what are the behaviors or risk factors that lead some people to age unhealthily and lead others to age healthily? And then finally, what can we do about those things? So this picture here and sort of preparing for today, thinking about what does it mean to have a sort of healthier physically and mentally? I actually find it very difficult to separate those two things. It's not something that I sort of treat as a dichotomy. But what does it mean for dads to live healthier and happier for longer? And this picture sort of reminds me that, when we think about this topic, we have to take a life course perspective. So we have to think, as a father who is preparing for fatherhood, as a father who is going through the early stages of fatherhood, through to a father of teenage children, through to a father of grown-up children, and then being, a grandfather or being a father who's supporting children and their own father. And so when we think about what does it take to help us live healthier and happier for longer, we have to overlay this lens of what stage of the life course that we are in. But in this presentation, what I'm particularly interested in is thinking about the nature of the transition to fatherhood and how does that teach us and prepare us for that life course trajectory. So I'll say a little bit about Younger Lives, not too much. We were founded in 2014. We're focused on healthy aging, as I've said, behaviour change, and we do a lot of impact evaluation, so evaluating programs that have been developed. And the name Younger Lives isn't because we're interested in younger people per se. That's not our focus. We're called Younger Lives because actually we know that the things that we do day in, day out, the behaviours that we engage in, the risk factors that we carry around with us can age us prematurely. And if we can control those things, we can actually assume the risk of somebody younger than us on average. And what's interesting about that is if you look at this chart on the screen in the right-hand corner of the two, so chart B, what this shows is the age that people feel that they want to be versus the age that they are. And what you find out that around 40, there's no surprise, around 40, we all start to feel a little bit of sort of impending sort of existential crisis. And we all feel that we want to feel a little bit younger than our age. And that's a universal phenomenon we've seen around the world and actually a really good motivator for getting people to think about making changes. Let me move on. So the first thing I've got to say, and I was talking to Chris before about this extraordinary, frustrating process of trying to find data from large studies that are cut by fathers. So if you look in any large cohort study, if you look in any large major sort of study of health across different nations, it's extremely difficult to find data cut by father status. And I just put this in the start of this process trying to find data. I just entered into PubMed, which is where I go to do a first search of all of the material in the literature published, and entered father's physical health. And the first response I had back is, did you mean mother's physical health? And I think it says a lot because, of course, there's been a huge amount of work done on maternal physical health. That's completely unsurprising, but very little relatively on father's physical health. If you look at interventions around health behaviours targeted at fathers, there are extremely few. So the recent meta-analysis of physical activity programmes in this scoping review, one observational study, 2 intervention studies, 1 qualitative study, compared to tens in mothers and more where they're both looked at. So we also seem unprepared for the future. This is a recent review of digital parenting interventions for fathers of infants from conception to 12, and a systematic review of studies that have been done. And I just put in the conclusions in contrast to the current state of digital interventions for mothers. Father-focused interventions lack evaluation evidence. We don't have the good evidence on what works for dads in digital interventions, despite new and expecting fathers wanting to use digital technologies to address very specific father-specific barriers. So we're not well prepared in terms of evidence for this talk, which is slightly worrying. So I'm going to be a little bit more narrative and selective about the data. And I've talked about how did dads live longer and healthier and happier by taking a life course approach. And obviously the first set of things that we know that healthier lifestyles and healthier environments in that period of fatherhood are really important. This is, sorry, I should explain this graph first. This is just the annual risk of death by age and sex. And what you can see is that it goes up exponentially with age. And we all know that the risk of mortality in women is lower than that in men. And we know that typically men are less likely to engage in healthier lifestyles. We're also pretty bad at controlling risk factors. So we're less likely to go and speak with the doctor if we have about our blood pressure or anything that we find on us that might make us feel concerned. And so those two things in and of themselves represent a substantial part of what makes us live longer or less long. And putting our younger lives hat on, what we would argue is that we can actually, by improving those things, reduce the risk that we have to something which is lower than we would expect for our average age. Now, of course, once we enter the later years in life, then we also have to deal with how we manage emergent diseases, how we manage our quality of life as we progress through those conditions. And what's really crucial then at that point is having a really good, strong social support system, because we know that men who have good, strong social support at that phase of life will also live longer than those men who don't. So we can see here, just from a simple illustration, the effect of the life course changing our needs from one decade to the next. Now, on average, having children appears to be associated with increased life expectancy. So this is data from Sweden, where most data on dads seems to be, because that's the group that seems to do the most work. Now, if you look at this chart on the left-hand side, this is the risk of mortality on the y-axis. If you can see my cursor going along this second line down, this is the risk of, this is a mortality risk in men with children, and this is above it is the mortality risk of men without children. On the right-hand side, you can see the effects of comparing that to different groups. So if I compare the risk of mortality in dads compared to men who are unmarried, what you can see is this advantage of death risk difference. What a beautiful phrase that is. That difference increases with age, and you see as you get to much older ages. And I think that is something to do with the nature of social support in that fathers have. It doesn't go up quite as steeply in married men as it does in unmarried men, but it's still there. There's still this differential. So there is a difference on average in terms of being a father and having greater life expectancy. If we look at that by number of children, so this is another study looking here at and here we can see in the light blue, once you focus on the light bright blue bar here, which is fathers. So this is, sorry, I'm pointing at the wrong chart here. I want to look at the men. The men would be helpful, wouldn't it? So the light bright blue line here represents the relative risk of mortality. So this is the mortality in parents divided by the mortality in people who aren't parents. If you look at this light blue line, what you can see is that 2 is the magic number, 2 to 3. And 2 to 3 children is associated with a reduction in mortality risk, and that starts to climb with increasing numbers of children. This dark blue bar represents what happens when you adjust for socioeconomic status and education. And what you can see clearly is that this advantage that fathers have in terms of life expectancy is significantly related to socioeconomic status. And by way of comparison, these 2 red lines here represent the effect of adopting children. So if you adopt children, then there's a significant increase in a reduction in mortality risk in adopters of children. And when you adjust for socioeconomic status, it has very little impact. And the reason why that is that the process of going through adoption is so selective that you are selecting a very, very narrow range of people who have a selective mortality advantage. So the point of showing this is that, yes, there is an advantage to fathers in terms of life expectancy. It seems largely mediated, not completely, but a lot mediated by socioeconomic status. Now, we know that lifestyle factors modify life expectancy. This is data from the EPIC study going back to 2008. And if you just look at the number of health behaviors that people engage with and then follow them for 14 years, you can see that the proportion of people who die having zero health behaviors significantly greater than those who have more of those health behaviors, and those health behaviors being physical activity, healthy diet, low alcohol, and not smoking. And that's no surprise, but actually the cumulative impact of this is substantial and represents a difference of about 14 years of risk. Now, in terms of fatherhood, we know that healthy lifestyle behaviors change in the run-up to and during that initial fatherhood period. The data to find this data was extremely difficult, took a long time, very frustrating. But if you look at studies that are specifically focused on fathers, what you find is a very large proportion of prenatal fathers overweight or obese, and the so-called dad bod of weight gain during fatherhood does seem to be sustained over the lifetime on average. So this period where we gain weight during fatherhood is sustained for the large part. Again, going back to Sweden, finding that 18% of prenatal fathers reporting binge drinking at least once per month, and looking at physical activity, a meta-analysis of physical activity on fathers, which was quite good, was actually a good study, demonstrated a reduction in minutes of physical activity in fathers compared to non-fathers, looking across all of the data. Now, I spend a little bit of time going through this because it's a busy slide. This is data from a study called UK Biobank of about 500,000 people. And if we look at the relationship between lifestyle factors and all-cause mortality, we can see that with reducing numbers of lifestyle factors, the risk of mortality increases. But it's most strong in those who are of low socioeconomic status. And in fact, if you look at those with low socioeconomic status and high levels of health behaviors, it looks fairly similar to those with no healthy lifestyle factors in the highest socioeconomic group. So there's a significantly stronger relationship in this lower socioeconomic group, whether you look at all-cause mortality, cardiovascular mortality, or cardiovascular disease itself. I should say here, again, this is an excellent study. It's small, but I think it's starting to ask the right questions. What do we know about expectant fathers compared to mothers in this prenatal period? Well, we know that they have, according to this trial of 200 mother-father pairings in Boston, increased body mass index, lower fruit intake, decreased sleep, increased physical activity. But before we start celebrating too much, we're comparing ourselves to pregnant mothers, and no recent primary visit to the doctor. So what we would expect to see is definitely what we see in expectant fathers, but it masks quite a variety. So about 25% of fathers report relatively high health behaviors. Sorry, I should say 25% plus 34, almost 70% of fathers reporting a lot of reasonably good health behaviors. But in this study, what they asked them to do is to say, not only report their health behaviors, but to ask them the question, as you approach the period where you're about to have a child, how much time do you think you will be engaging with childcare? And so a 25% of men who were engaging in high health behaviors were less likely to say that they were going to engage in healthcare with infant care. And 34% engaged with more health behaviors and said they were more likely to engage in in infant care. But if you look at those who are engaged in less health behaviors, whether they're engaging in less or more infant care, what you find by looking at the socioeconomic status and health indicators of those groups is that people who engage in more health behaviors tend to be married, they tend to be more likely to have a bachelor's education, they'll have higher income, they're less likely to be socially isolated, and they're more likely to be white. So you can see here the overlay of socioeconomic status affecting even the perceptions about what's going to happen in that period post birth. Social connection, extremely important, already mentioned it. Social connection we can split into 3 different types. There is the sense of connection that results from the relationships that you have and the roles that you have. There is a sense of connection based on the perception of the quality of that support that you're getting. And you can then stratify individuals with a social network index score and follow those individuals and say, let's look at those people who are really very socially isolated versus those who aren't socially isolated. And what you find is that the survival of those individuals, those men, this is the top graph is men, you can see that the survival rates of men who are very isolated significantly lower than those who are less isolated. And we know this is true for both men and women. And this is a review by Joanne Holt-Lundstad, which I'd highly recommend if you're interested in that topic. We know from research with Movember, actually, that a reasonable proportion of men report being fairly or very isolated when first becoming a father. So about a quarter of men felt they were fairly or very isolated during that period. About 20% of men said that the number of close friends that they had decreased after becoming a father, and 28% of those men who were without close friends were more stressed after becoming a father. So we know that this experience of social isolation is a critical period, a critical factor within the transition to fatherhood. If we look at single fathers who have the lowest social support, their mortality rate skyrockets compared to partnered fathers. So you can see it's almost twice that of partnered fathers and significantly greater than in mothers. So with all of that apparent bad news, is there an opportunity to impact longevity in dads? And so again, from our younger lives perspective, we'd see this as reducing that risk of all-cause mortality as early as possible and trying to maintain that over the course of the life course, either by promoting healthier lifestyles and healthier environments, improving the ability to engage men in talking with healthcare professionals, and by building a sense of social and family support for across the life span. And we know that there are significant challenges in remaining healthy during parenthood. So whilst we have a very strong desire to be a role model, and you see this is a paper from Baldwin about 6 years ago, a systematic review on mental health and wellbeing in expectant fathers. There is a strong desire to be a role model. Fathers will express that. And they have a desire to couple that to health goals. So to be, for example, physically active for their children and to act as a role model and display that. But we come up against tensions between our life goals that we have and our work goals. And men have a very strong sense of primacy of work. We know that men are faced and fathers faced with resource pressure, and the more of children that we have, the more that becomes a greater pressure. And we know that fathers experience uncontrolled levels of stress during this period. All of these make these sort of nice goals very much more difficult to achieve in real life. And so these boxes I've coloured orange here because we can go either way here. If we want to be able to turn these green rather than just having them as orange. So if I find, for example, if I find ways to cope with stress through physical activity, I'm more likely to engage in healthier lifestyle habits than if my finding ways to cope involves alcohol. And so the need for us to be able to see the holistic picture when it comes to fathers' physical health is vitally important. So I've animated this and forgotten to animate it. Never mind. So what do we know about what works in dads and kids? Actually, very little. This is a study from the University of Newcastle in Australia, who have run 2 types of interventions, one called Daughters and Dads, where they engaged fathers to be physically active with their daughters together. and to see that as part of the role modeling experience. And also Healthy Dads, Healthy Kids, which was a weight management intervention, again, focused on this relationship between fathers and children. And they were effective in significantly increasing physical activity and significantly reducing weight and waste in dads and children. But one of the problems that we have is that when we look at those sorts of interventions that are carried out in a particular area of the world, we struggle to replicate them when we take them into other countries. This is a trial of Healthy Dads, Healthy Kids in the UK, focused on a socioeconomically disadvantaged group. And what they found here was that a third of the participants allocated to the intervention group just didn't engage with the programme. And this is a real challenge, because we see something that's effective in one part of the world and we want to use it in other parts of the world. But when we try and change the population that we're targeting, then sometimes we don't see the same effects. And so unfortunately, this feasibility trial didn't go through to full evaluation. So how do we protect against all of these challenges? So this feels like, to me, a topic for environmental interventions. So rather than trying to focus on individuals and trying to target specific individuals, we need to do something which lifts all boats. And so we need to balance better work and life goals. We need to align those parenting goals with health goals, but we need to reduce the resource pressure that they're under. We need to think about how we enhance healthy coping behaviours and manage the stress response that comes with that transition through fatherhood. And this potentially is a role for paternity leave, because I also know this is something that future men are particularly interested in. Now, this is data from Pregnant and Screwed survey, recently put into chart form in the Men's Health Forum. And we can see that fathers who had access to enhanced parental leave and pay and used it in full is dramatically related to household income. So, of course, we think that we're going to do something that's really very helpful, and actually we're only making it available to those people who need it the least. If we look again back to Sweden, and we look at, is there good evidence that paternity leave in particular has an impact upon longevity? Now, it's they've been going a long time, but it's still sort of relatively early days in terms of tracking longevity. But what we can see here is a measure of alcohol-related morbidity. This is 2 years post the introduction of paternity leave, and you can see that there's a reduction in alcohol-related morbidity up to 2 years. In this chart here, up to 8 years, and in this chart here, up to 18 years. So a 34% reduction in the incidence of alcohol-related morbidity post-paternity leave introduction, 26% after 8 years, and 28% after 18 years. So there's some good emerging evidence that paternity leave has significant health benefits that seem to last for a considerable amount of time. So just checking my watch, we're probably at the end of the time allocated.
Mark, keep going if you want to, really.
Okay. I'll only take another couple of charts.
Okay.
I'm quite involved in healthy aging, and the UK government a few years back pronounced that its objective was to give everybody 5 extra years of healthy, independent life by 2035, and to narrow the gap between the richest and the poorest. And that narrow the gap between the richest and the poorest is absolutely crucial, because in the European Union, their attempt to talk about having extra years of healthy, independent life didn't feature that component. And when you do that, all you need to do is to enhance the healthy life expectancy of those who are already healthy in order to hit your target. So it's important that you have this component. In order to do that, what do we need to do? I think we need to focus on lifestyle changes that make the biggest difference to health and well-being, and in particular of dads in this context. We need to build social support networks for dads across all stages. So whether it's in the antenatal stage, the postnatal stage, and throughout the life course, social connections have as strong an impact on mortality outcomes as smoking. So these are extremely important things to build in. we need to focus our programmatic effects on those dads who have come from the lowest socioeconomic groups and communities. If we're going to run programs, we have to focus on the needs of those groups, because it's too easy to generate programs which are going to work in those who are already healthy. And we need, I would argue, I think there is emerging evidence that we should be increasing the opportunities for parents generally, and for fathers to have better paternity leave policies, so that they can have the opportunity and the space to be able to develop what it means to be a father, trying to live a healthier life for themselves and for their families, which would benefit everybody and not just men. And then finally, we need much more data, many more trials that are focused on fathers, and much more implementation effort to work out what is it. There are lots of people maybe in this room or in on this presentation who engage with practical work on the ground with fathers who are not able to access funds to evaluate what works and what doesn't work. And I think it's pretty clear that we're going to have to learn a lot more about that systematically than we have been doing today. And so a lot more support for those of us who are running, or those of you who are running those sorts of practical programs on the ground. So how do we engage dads to stay younger, happy, and for longer, if I put it in our terminology? So this is a quote from one of the participants in the Healthy Dads, Healthy Kids program. And he said, I can't recommend this program enough. It's probably added years to my life expectancy, possibly, yes. But more importantly, it's added immeasurably to my quality of life and my family's. And this comes back to, I guess, our perspective on what healthy longevity really means. Healthy longevity is not just about adding years to life. It's about adding life to years. And so it's not just about making sure that we engage in physical activity and eat well and don't drink and don't smoke and have a healthy body weight and all of those good things. What it's also about is extracting as much out of life as possible in terms of the quality of life that we have. And often in healthcare, we typically focus that only at the end of life. So we think about maximizing quality of life with patients with conditions or older patients who are in homes. And we don't think about that as a learning experience that we take throughout our life, about maximizing quality of life. And the reason why that's important is because it's that quality of life and that perceived quality of life that, by connecting it to the health behaviors, allows us to get both of those things at the same time. So we have a program called Life Age. It allows people to identify for themselves what age they most likely look like from a risk point of view, based on their health behaviors. But we also ask them a series of questions about how often they spend time doing things that show they value their own well-being, doing things that give them the opportunity to connect socially with other people, playing an important social role, and doing things which give them a sense of meaning and personal growth in their lives. And those things we know from other research we've done with heart failure patients are the things that make the difference in terms of whether you end up in hospital again or whether you're able to stay out of hospital, and whether you can manage your mental health. So we see those two things, both the health components and then what we call happiness, but it's really quality of life components. These are the sorts of things that we want to promote. And we think, looking at some of the responses from people who've been in such programs, that these are the things that resonate with them. And then just to finish, this is my final slide. The reason why I'm interested in this is not just because I'm a dad. It's not just because I like Chris. It's not just I like future men. I think this is a really interesting topic because life transitions are often the catalyst for change. Whether you are a patient who's had a heart attack, whether you are somebody who's had a recent diagnosis, whether you're somebody who's going through relationship difficulties, whether you've been made redundant, whether you're approaching retirement, they're all moments at which we reflect on our life goals and what is it we're trying to do. So men, when they become a dad, we know from the literature, think about themselves as becoming a role model, playing a role modeling role. We have these life goals, and we think there are certain things we need to do in order to act in accordance with those things. But life makes it really bloody difficult. So society makes it difficult. Economic stress makes it difficult. We may be able to help with programmatically and with support. We may find that paternity leave provides us with a space and just a bit of breathing space to be able to manage those work and life transitions. As we go through those goal-based activities, we will assess for ourselves how well that we're doing. Are we doing well? Are we disappointed? Do we need to make change? And we might calibrate our expectations and adapt our goals as a result. Those things that we do well hopefully become long-term habits that help us with our longevity over the rest of our lives. But this calibration adaptation, I would argue, requires space. It requires space for us to learn. And I think that's what things like paternity leave give us the possibility to do with our partners. So I'm going to stop there. It's a kind of more a kind of personal and summary view of the role of fatherhood and paternity leave in particular. Yeah, I'm finished and happy to take questions.
Mark, firstly, that was, you've provided us with so much evidence around the protective factors of fatherhood, but I want to just share a story with those who are on the call from my work when I was working with young offenders. One of the service users I was working with, a boy, 14 years old, from an ethnic minority background. And this is not really about fatherhood, but it's about this idea of longevity and also the psychology of longevity, perhaps, as well. So we were sat in the room doing our session, and part of what I was trying to impart on him was the idea of delayed gratification, trying to see life as a longitudinal experience. Now, for 14-year-old boys, this is, I wasn't using these words, and the expectations may have been, maybe a little bit extended, but ultimately that's what we were trying to do, to try to help them to see life as a long process and also go through some emotional and central nervous system regulation. And when talking to him, his response was, and it was one of those moments where he kind of leant in, big lad too, and he sort of said, Chris, what you don't understand is that where I live, and ironically, where he lived was just down the road from where I lived, but it shows you that whilst we use the index of multiple deprivations database to assess deprivation, my postcode was pretty much the same as his. I would also qualify as being deprived, but my family wasn't. And he says, where I live, anybody over the age of 55, you either don't see them because they can't get out, they're really ill and self-medicating, or they're walking on the street muttering to themselves. And what we kind of worked through was that he had a sense of being as old at 14 as I was at 34, relative to his social frame. And it was also interesting because obviously this young man, this boy, was with me for having transversed the line of criminal justice system, which might reasonably, it was in this case, be associated to a sort of view of a quick win, right? I can't see myself excelling in this world as it's presenting to me, but if I take this route, I might get there. Who knows? And I just thought, everything that you've been talking about there as a leverage point, as a transitional moment, which is definitely, this is language that we use at Future Men, and thinking about potentially also the knock-on effect to that aspect of role modeling, which we know is so important when looking at behavior change amongst cohorts. And if you can make little changes to enough people, then you can make a cohort change, So I just wanted to share that before coming to some of these questions. So if I'm going to reel back up to the top, and thank you for all the activity in the chat. So Owen asks, who funds this research and data gathering on fathers and men in Sweden? Is it a government initiative?
Yeah, so I think it's funded by Sweden's Health Research Institute. So I think when they established the paternity leave changes or maternal leave changes, which obviously revolutionary. In order to, it's pretty obvious you're going to need to evaluate that. You're going to want to know whether this has made a difference. What are the long-term benefits? And Sweden's pretty good at the sort of policy evaluation side, and so it has this sort of infrastructure in place. It has the right, academic groups in place to do that. So the funding is governmental, which is the sorts of things that we should be looking for here.
Yeah, when thinking about how this role that Future Men has taken on under Agenda Dad, and how we are going to take this work back into the APPG space, again and again and again, we hear the word data. We need to figure out how it is that we're going to collect the information to be able to do the segmentation of stuff. Owen, you've got your hand raised. Come on in.
Yeah, it was just a comment, really. Thanks for the answer. Thanks for the presentation, number one. Great, really interesting data. Thanks for highlighting as well the counterbalances between those from the lower socioeconomic groups and your 2.4 Middle England dad, and making sure that we don't lose focus there. It's interesting to me, even the way you detail the way Sweden funds it, and I know we make assumptions about the Scandinavian nations being advanced in some social elements of society, but the fact that they made the decision to fund all these changes in the way that they allocate leave to fathers and then evaluate its effectiveness afterwards. Whereas here, it seems to me, we have to prove its effectiveness first before we can make the changes. They want an evaluation before any action's been taken place. How do we shift that mindset here?
I totally agree. I think some of it's ingrained, but the one thing I would say is that it takes very little to actually add a question into the ONS, or add a question into established health. I mean, I say it takes very little. It is an effort. I'm not saying it's not without effort, but that would make a substantial difference to be able to even just cut the data accordingly, rather than, and it's the same in the US as well. The largest surveys don't have that question in, and so what we end up doing is looking at, well, what do men do in the sort of ages 22 to 30, and what are their health behaviors? It's completely unacceptable. So I think some simple changes, first of all, so that we can campaign for is better sort of integration of relationship status within our current surveys. That will also give us some. And typically, what happens then is we get some data to start making a case for the sorts of interventions that we need and the evaluation on top of it.
We have a comment from Dave Edwards, reducing parental conflict. I heard research pointing to the difference in likelihood to go to a GP was the same for both sexes from age 66 onwards, possibly suggesting men see taking time off work to go to the GP as a real barrier. And then he's put provider role. And Dave, to that point, I've seen the same, and it's pretty much the same presentation rates up until about the age of 11. And then the charts skew quite significantly. And the chart that I'm referring to was I'm going to get this wrong, but I'll get it right when I put the information out. Wang et al. 2013, and the data also shows that where there's greatest variance is around the age of 34, 35. And yet what, Mark, and I'm not putting words into your mouth, so you can correct me if I'm wrong, but this is where this fatherhood teachable moment really comes in, because the mother, the female teachable moment, if that's the correct word, might be more towards adolescence, when menstruation begins. And there's a greater understanding that of the physical health needs of a female, and boys don't have that trigger point. That trigger point happens later on in life, and then the oddity might be that, or the challenge might be that some of these behaviors, they're not set in granite. There's always a possibility for plasticity, but it might take a little bit more course correction, so to speak. So I just wanted to share that comment. Thank you, Dave. Mark,
Just
did you
sorry,
have to?
just
Yeah.
to add to that, and I agree that it's clearly a lot of this is related to inability to take time off work as a major barrier. We have evidence from the NHS Health Check programme that men of the same age group are less likely to attend. And they're less likely to attend for, again, the same reasons. The challenge is that, you know, we are not making it easy for men who, you know, men at work to go and feel that, whether it's, you know, it could be partly structural, it's also partly around the norms around prioritizing yourself over work, which is clearly also another male perspective. Yeah, I think that is definitely one of the core reasons why we see those differences. It's definitely not just about men won't go to the doctors. That's a very sort of old-fashioned view, I think.
Yeah. Jessica Hobbs asks, what are the most important research questions you would like to see addressed about fathers' physical health? And what is your view about qualitative research on this topic?
Yeah, so qualitative research is absolutely essential, because without that, we're not going to be able to frame the interventions. We will end up having interventions designed by people who don't really, who have a preconceived notion about what's required. So I think not just qualitative research, but also much more ethnographic research, much more when we're thinking about taking trials like the Healthy Dads, Healthy Kids study, spending a lot longer trying to work out the mechanics of how that works in different populations. I guess what's called implementation science. So how do you take something that you know works somewhere else and make that work in a different population or a different setting? Those sorts of messy, you know, what might be considered messy sort of research are the things that are going to make a big difference. So I see much more of that. On the quantitative side, or I guess the epidemiological side, what I think we really need to be able to look at is how long does this period of changes in health or health behavior last, when we say we have this period of, there's very little data looking at what happens to fathers over the longer term. How long does it take for physical activity to return or for weight to return? It seems that it doesn't, but we don't have enough data on that, which would be very helpful in thinking about what time how long do we intervene for, when can we get people back onto, back onto an even keel, if you like. So yeah, I think that there are a whole host of research questions which we can spend a long time on, but primarily my interest would be on qualitative and implementation science. How do we make sure that we understand how to implement what we think is going to be effective in a way that meets the target audience that we don't currently do very well?
I mean, it also thinking about the barrier that is positioned by work for some, if not many, fathers. It seems like there's a gap, because what we're saying to some degree is that the social connections fall out, but men are at work. So why can they not also socially connect at work? And possibly they are, but possibly they're not taking that into a way that actually becomes a positive health habit, or there's some type of barrier within that, which possibly has to do with self-stigma, or the idea of if I say too much, I might nullify the potential for a career progression, etc., etc., etc. And I don't know. It seems like there's an opportunity, but also a potential psychological threat by doing too much in that space, to make it more of a supportive space. And that's just me sort of talking off the top of my head, really. But it's that idea of going where men are. And of course, more and more women are obviously featuring in the workplace at all levels, and greater number of hours per week as well. So maybe there's a jet lag effect whereby we will start to see some of the similar presentations, although there seem to be different cultural norms as well around females than there are around males. Coming back to questions and thoughts, is there data on the age at which men become fathers? Is early or late fatherhood more associated with better health outcomes, factoring in poverty, etc., in younger dads?
Yeah, good question. That I didn't put that in. There is data, and I'm sure you can guess which country it comes from, on the age of fathers, and it certainly seems to be the case that that older fathers, so the age that you become a father has limited impact upon sort of longevity advantage. But that again is largely described by socioeconomic status, because it's there, but when you adjust for socioeconomic status, younger dads tend to come from lower socioeconomic backgrounds, and so it's confounded by that. Yeah.
Also, let's see. There was a question about. Oh yeah. So what might be the impact on social norms for those children growing up in families where fathers are more present and possibly engaging more in active childcare? And this was a question that came off of Neil Peters from Nuthatch Consultants. The point that he was making about how it's interesting that shared parental leave is taken up by those that need it the least, in inverted commas. So you have this, and I've talked about this in other spaces as well, this kind of privatization of social outcomes, whereby the people who are potentially most mobilized and have the greatest agency are also receiving the greatest benefits. And what happens over time when you start to think about the impact of that? And of course, this is not a new thought whatsoever. We've already seen these things occur. But is this an opportunity to make a positive intervention in some of this?
Yeah, I think what's interesting is if you look at socioeconomic status more broadly and its relationship to health, it's a relatively recent phenomena. Post-war, so really it's from about the 1960s onwards that you can start to see this difference between people of low socioeconomic status having the highest risk. If you go back many years before that, it was the opposite way round. So it's actually a relatively recent phenomenon of like the last 40, 50 years or so, where we see that so if you look at unskilled workers versus senior managers, there's a very strong sort of gradient now in terms of risk. And I think that's something to do with how we've sort of mismanaged. I personally think that's something to do with how we've mismanaged resources and resource allocation, that we've been promoting policies which have systematically disadvantaged those groups, and we have actually ended up giving resource to those who are more mobilized and able to access them.
Yeah. I'm aware of time, so I just want to highlight a couple of things. Dave Edwards, Reducing Parental Conflict. I've just been talking to English Football League Trust, who are up for using their voice to reach the men other services struggle to cut through to. So thank you, Dave, for sharing that. And as again, I will be collating the chat, editing it to make it more readable and sharing that out. So thank you very much for that, Dave. Thinking about Dave again says, thinking about attitude, I did some focus groups on pensions, retirement years ago, and men said they plan to work till they drop, and it wasn't a joke. So yeah, a highly impactful statement there. Mark Brooks, shared from the Men and Boys Coalition, shares a great set of data that again I will pull out and share over social media. And he also shares his email address. Dave makes the point about research on Twitter today, points to 65 studies that indicate that female-dominated careers, including those influencing fathers' outcomes, are just as discriminatory against recruiting male workers as they were in the 1970s. And I think if I might sort of take an opportunity to nuance that, there is this search for equality where it's like we're looking for equality rather than and Mark, I want to say, as I said before when we were coming into this, what I've loved so much about your presentation and your overall approach towards this is the idea of segmentation, because otherwise we can straw man all men and straw man all women, and then it becomes a very zero sum and we lose focus on where the energies and efforts need to be. We have all these sort of biopsychosocial constructions of an identity, and actually being able to parse through them and understand which services apply to which individual, and then understand how we can mobilize the individual to go towards the service that they might need. Where do we need social intervention? Where do we need psychological intervention, etc.? And I've just really, really appreciated how nuanced you have been in all of this throughout this presentation. Mark has just reminded us to use hashtag International Men's Day on Sunday. And Mark, may I suggest that we use it leading up to Sunday, because many people are going to be very busy on Sundays, hopefully with a very happy, healthy, fruitful life. Mark, are there any words that you would like to use or say before we wrap this up?
Well, so first of all, thanks for the opportunity, Chris and Owen and everybody at Future Men, because it's been I do a lot of work with Movember, which is great fun. I know they also do quite a bit of work on fathers, but to have the opportunity, just to carve out my own mind to think, okay, let's go back to the data and see what we do know. What do we know? What do we not know? I think it's been a great opportunity to be able to do that, and to personally give myself the space to do that. So thanks for that opportunity and the opportunity to share and talk with you guys. I out of all of this, I guess my overall feeling is that I feel that that we should probably be thinking about paternity leave much more than we do. I think that if you look at some of the barriers to fathers creating healthy routines post-parenthood, I just struggle to see how that's going to be dealt with programmatically rather than through policy, because it's so difficult to be able to afford to spend money on programs for different segments. And whilst I kind of lean towards those sorts of activities a lot of the time, I think that this shows that we need a much stronger and a much stronger evaluation of the benefits of that, as per Sweden, as Owen says. I would say that would be my takeout from this review of the data.
Fantastic, thank you. Charlotte, I can see your hand up.
I just wanted to ask Mark, would it be possible to have your presentation so that we can make it available on the Future Men website? Obviously the recording of the meeting will be there as well, but it just might be easier for people to just look at the PDF if you wouldn't mind.
Absolutely. And I also, I'm just going to put my email in the chat if anyone wants to ask any other questions at a later point, or talk more about what they're doing. Happy to discuss anything that any questions that they have. But yes, more than happy to send the slides.
Thank you, Mark.
Fantastic. Well, on that note, thank you everybody for joining. Late lunch or early coffee break, I'm not sure. Although coffee at this hour would send me loopy, I wouldn't sleep, so I will desist. But thank you all again for joining. We have another one coming up in a couple of weeks' time. We will be promoting that very shortly. And thank you for all of the comments and the questions. Really great. And looking forward to happy International Men's Day on Sunday. Take care, everybody. Thank you.
Thank you.
Thanks.
Thank you, Mark.
Thank you.
Thanks for attending, everyone.